Progress Women in Surgery Fellowship was set up to promote female participation in surgical training at fellowship level. Would you be able to explain a little bit more about why the fellowship was set up and specifically how it works?
Okay, thank you. So I suppose the reason the fellowship was set up was that we identified at the end of basic and higher surgical training as two key points when it was difficult and when we were losing some of our female trainees. So we published research in the Annals of Surgery in 2019, where we surveyed a large number of surgical trainees, and 39% of women said that their fellowship of choice was adversely affected by being a woman, and 29% of women surgeons felt that they missed out on a job due to their gender. And overall, 61% of women felt that they had fewer opportunities to progress their career by virtue of being a woman. And really, those things just aren't acceptable to RCSI. We pride ourselves on a very fair selection process, and it's just not acceptable that people have those experiences. And if that's the perception that our trainees have, then we need to very actively and very visibly change that. And so one of the outcomes of the Progress Group and the Progress Report was that we recommended that there would be a funded fellowship to support women in surgical training. And the completion of higher surgical training is a very exciting time in a surgeon's career. They've completed, an 8-year program of very intensive training. They've passed the intercollegiate examination, so they have an internationally recognized qualification demonstrating their competence. But it can also be a frightening time because it's the completion of their guaranteed jobs. For the first time, they enter the competitive job market, and in that job market, having a fellowship or having post-CCST training really gives you a competitive advantage. We also know that most of our surgeons, as they approach that time, are in their early 30s, and that's a time when there are many other challenges in life. Many people are thinking about or already have a family. Many people are in a relationship with a partner who is employed, and it's not so easy just to pack everything up and go abroad and spend a year honing your craft. So we felt it would be a very visible way to support women securing specialty training. We felt it would be an important way of demonstrating our support for the health service, that these doctors would have the opportunity to go abroad to develop highly specialized skills. And we hope that they will come back and provide those skills in the HSE. And to date, that's been our experience. So those are the motivations really for the Progress Fellowship. And it's something, that we're really grateful that has been supported by industry so generously to enable us to offer this opportunity to our graduates.